And welcome back to the auditorium at Willard High School, where we are having the Lock & Smith Foundation Political Forum between the Republican candidates for the United States Senator from Missouri. They will be elected, one of these candidates, on August 7th in the primary to face the Democratic incumbent, Claire McCaskill. We just spent about 30 minutes talking about government philosophy. Next, something that has been very on the minds of many people, and that is health care. For that, we have the president of the Lock & Smith Foundation with us today, Dr. John Lilly. He's going to be covering a variety of issues on that. Dr. Lilly is a family physician with Mercy Clinics. Dr. Lilly, it's all yours.
Thank you, Jerry. I would like to point out that all three of the initial questions in each one of the topics were given to all of the candidates ahead of time, so they had ample time to prepare for our first question. And our first question is kind of a long one, but we wanted them to delve into something really deep. So I'm going to try to keep things moving along. I'm going to repeat the health care question, and it is, according to the Congressional Budget Office, by 2050, the entitlements Social Security, Medicare, and Medicaid will consume all of the national government's projected revenue, with Medicare being the largest and fastest growing component. Medicare reimburses physicians primarily with a fee-for-service model and hospitals with a lump sum payment based on diagnosis-related groups. What specific policies would you propose to control Medicare costs? I'm going to mix it up a little, and I'm going to start with Mr. Brunner.
Thank you very much. I'm observing your figure 3 here on your chart, which really demonstrates very clearly the skyrocketing element of health care versus the other discretionary spendings and other mandatory programs, Social Security as well. You know, this is the biggest challenge, and that's why it's a great question. And number one, there just is no longer an effective market. The federal government has regulated health care basically out of existence. And what we need is a deregulated, competitive market. We need a situation where prices are actually posted. We need new competition, not more regulation. You know, the concept of certificate of need in terms of bringing in a new hospital or new resources. And I know in our business, we serve many retailers. And there's a lot of competition in retailers, and competition generates lower prices and better products and better services. But I can't imagine for the life of me that Target could have, or a Walmart, or a particular retailer could have the monopoly to declare to their competition that the competitors have to go through a certificate of need to open up another retail store.
Would you repeal the certificate of need? A lot of that is done at the state level. Would you try to eliminate the certificate of need?
Yeah, this is just part of the total program. I mean, you have a layer of these issues that pile on. Any one of these in their own are not problematic, but when you have this total impact and all of these regulations come in, that's where you have the problem. The other area is in terms of having true buyers clubs. You also need to have a health care that in a competitive market would have a guaranteed renewable, so you could carry that with you in the future. You could follow it from job to job to be portable. You could move across state lines, that you could choose the particular benefits that you'd want and not have all the benefits mandated. If you did not need acupuncture care, you shouldn't have to, increase the cost for that. So here's my summary here. I think we need to remove the regulations that keep prices up and competition and innovation out. And a big part of that is tort reform that is just causing a tremendous crunch, and we know that that adds even more cost to the system. You know, the good initiative, and I've looked at many of these programs that are out there, and of course, because the problem is so tough, and I'm afraid we have too little leadership in Washington, D.C. to deal with this. I mean, this can has been kicked down the road year after year after year, and this is not a new problem. But I was particularly impressed with Ron Wyden, a very liberal senator from Oregon, teaming up with Paul Ryan in a bipartisan plan for health care reform. Here you have premium support aspects with competitive bidding. You have means testing. You have the Free Choice Act that Wyden put together. It protects those seniors that are already in the program, and it creates a whole new element so that your chart is not going off the top, but begins to reverse that and turn that down with free market opportunities in the system. But it's not just the program that you need to present. You need to have that bipartisanship. You need to get people together. It's just as important on how you do that to drive the health care costs down as the program that you present. And so I looked at this one case study with Senator Wyden and Paul Ryan as a very good step forward. Now, regrettably, Ron Wyden's party jumped all over him, all the Democrats and the liberals, and they said, hey, you're going to be taking away the arguments that we have here for the election. And what's the big idea of trying to come together to solve a problem? So I keep driving back on many of these costs, as complicated and as tough as they are. You need to send people to Washington, D.C. who put the problem ahead of themselves and their career and have had that kind of experience in problem solving. These are the areas that are going to be able to reverse that curve and be able to get the job done. Right now, we're in a crash and burn scenario, as we'd say in the Marine Corps. With the right leadership, we can change that flight pattern and get us back steady again.
Okay, thank you. Let me go to Mrs. Steelman. How would you solve the Medicare problem?
Well, you specifically asked about Medicare. So
Yes.
I think there are a couple different ways, and there are different approaches out there to do that. One of them is the suggested plan that Mr. Bruno referred to, Paul Ryan's plan, that has a voucher or a premium that's given to Medicare recipients. And his newest plan has both the choice of either a voucher plan where you're given X amount of dollars from the government to go out and purchase your own health care, or you can stick with the Medicare plan the way it is today. So you have those two options in the Ryan Wyden plan, which I think that's one way of looking at Medicare. The thing is, we have to do something about it in order to keep it available for future generations and to make sure that we aren't spending ourselves into debt. So there's no question that Medicare has to be reformed. I think, I've taken the position that we've got to protect people who are on it today and who are getting close to being on it, whatever age that might be, 50, 45, actuarially how that works out. But I think there's also some other things that you can look at in Medicare if you aren't going to take the route that Paul Ryan's going, where you make some adjustments to Medicare as we know it today. For example, raising the eligibility age, that saves about 30.5 billion, excuse me, I'm still in the millions, sorry, $1 billion a year, and that would be raising it by about 2.5 years. You can do means testing. Again, that saves approximately $100 billion a year. Tort reform is another option, $23.3 billion a year. And then if you make drug companies pay their rebate back to the government, you can get up to $51.5 billion a year. So those are some specific things that could be done right now to help save the Medicare program today. And I think that's where we need to be looking at those kind of different options and see what works best. I think the preferable way to do it is where you do have the choice between a voucher plan and some of these other adjustments that can be made to the existing program, and people can choose. Now, I have one caveat on that, and that is to make sure that that voucher plan can keep up with the cost of health care, because that is a difficult population to insure. It's an aging population, and as you know, that makes it more complicated because as people get older, they get sicker, and so then it costs more. And there needs to be some assurance that that voucher plan can keep up with the cost of health care for those people who have no other means of paying for it.
Let me go to Congressman Aiken.
Thank you, Doctor. I'm going to try and keep it strictly on Medicare also. Let me just jump a little bit. You know, people that don't remember history have to pay the consequences. And in the tradition of the Locke and Smith Foundation, go back to 1600, and the British government set the price on a loaf of bread, a ton of coal, and a day's labor. And it just was a horrible economy. You had the Black Death comes through, got half as many laborers, but the cost for a day's labor is still the same thing. And finally, eventually, the British figured out we don't want the government setting prices and everything. Of course, we haven't figured this out yet. So you got Medicare, and the government's setting all of these different prices. So I think probably one of the very first things we want to do is to deal with that question. So what we've done is we've created an economic mess by the government setting prices. The next thing, though, is it's worse than that. It's not just lousy economy. It's actually rationing and what could potentially become the equivalent of people choosing whether you live or die. Because we've put this thing called an IPAB board into Medicare, and what that is it's 15 people unelected that decide how we're going to control costs. Oh, how are we going to do that? Well, Congressman Akin, you're too old to get the hip replacement, or your grandfather finds out he's too old to get a heart bypass. And so using rationing and the government in that regard is just terrible. Then in addition, what we've done is taken $500 billion out of Medicare. That's not a very smart thing to do. So what are the solutions to this problem? I think the first solution is something that, as a member of the Budget Committee, that Ryan and a bunch of others of us put forward as a starter. And that is, let's get rid at least of the price-setting mechanisms, and instead of the government setting prices for everything, we simply allow a whole series of providers to provide health coverage. And the person that's on Medicare can choose the provider they want for the kind of services that they provide. And if they don't like it, they can change to someone else. So first of all, you get rid of the price setting. Hopefully we repeal Obamacare so you don't have this IPAB and the $500 billion mess in here. And so that'd be the first thing, would be get rid of the price setting and to do that more through a multitude of providers. I think the second thing that's helpful too is the idea of that you could have medical savings accounts, because now you're moving back toward a market-based system with Medicare. So all of those things, I think, would get us going in the right direction. Your assumptions are completely right. And Dr. Lilly, I'm extremely concerned because we're giving the impression that these programs will continue and everything's going to be okay. And our elected leadership is lying to the public when they say that. These things are fundamentally broken. If we're going to keep them running in some semblance, they're going to have to be changed. I think the free market model is the way to go. Thank you.
Thank you. Mr. Beck.
First of all, this utterly mechanized health industry can never be straightened out. Number one, it will cost 3 to 4 times more than what they tell you it's going to cost. Out of this 4,000 page of health care, you have so many different programs in it, it brings taxes into the government, into the health care system. And it is a people-controlled system. It is not a free enterprise system. It will never work. Number one. Number two, you're not going to be able to get the care that you need when you go to the hospital. They're going to turn you down because you're going to have some bureaucrat in Washington deciding whether you can have an operation for appendicitis, for your heart operation, or your kidneys, or anything else. They're going to control it. You're not going to control it, and you cannot choose your own doctor like they say they can. Number one, they should never have passed this bill without voting on it. Each one of those senators should be impeached for what they have done with this health care bill. When I become the next U.S. Senator of the state of Missouri, I'm going to help President Romney get rid of this bill. And we're going to do another one that will work. And we're going to go back to the free enterprise system where everybody has a free opportunity and a free chance, and everybody can be taken care of in the right way.
Thank you. Mr. Memoli?
For solutions and ideas that have been generated, please go to memoli.org. Social Security and Medicare was addressed, so is health care, and I believe that when you see those ideas, you'll support it. Do we have a problem? Yes. In the last decade, our U.S. military's health care costs have increased 50%. When I was with a general sales manager at Ford Motor Company, he turned to me and said, Mark, we could budget anything, but we can't budget health care increases. And nobody on this panel can, because they've been skyrocketing and costs have been placed on fewer and fewer people that actually have insurance. I am not for any legislation that creates a long-term subsidy for people on Medicare, because it places debt on younger folks. And debt is what drives people into poverty, and we've seen poverty increase as a result. Third is I would cash out people that would like to get a lump sum payment and waive any future obligation on the part of the U.S. government. I think we could work out a workable formula with an average interest rate of 4% return. And there's a lot of details that I could go into, but a 2-minute response, I can't do it, but I can do it after this show. And please come up to me and I'll explain more. And I really believe that we have to undo Obamacare. The reason being is, why should any American ever be penalized because of legislation? What we should do is have a standard deduction for health care on W-2 forms. So instead of having to justify that your medical expenses exceeded 7%, we should just have a standard deduction for every person for the cost to have insurance for their family. That would remedy the situation. Everybody that files taxes would get a deduction for paying for health care, and we could bring it to more citizens. And tort reform is a no-brainer. We have to have it because of these lawsuits that are unjustified, driving up costs. And the bottom line is, let's attract more doctors into the profession. When people say they'll abandon the Department of Education, we could do a number of different things to bring science to schools so that people are curious and pursue the field of medicine. And with more doctors in the system, we'll be able to help people and reduce medical costs.
Thank you very much. One of the problems that we find in today's healthcare system, and one of the realities, is it's an employer-based system. The vast majority of people get their insurance through their employer. The employer is able to deduct the cost of the health care from their taxes, whereas an individual cannot deduct the health care from their taxes. I'll throw this open to anybody. Is there anyone that would like to see the ability for an individual to deduct the health care expenses from their personal taxes so that they could be on equal footing with the corporations? Congressman Akin.
Well, yeah, you've hit a real serious part of where we got off track, and I think that what you're saying is absolutely the way we have to go. The employer-based system was started right after World War II, and it creates a way for big employers to give sort of a tax break to their employees. But it also creates a massive problem because you've been working 10 years, your wife has some medical condition that comes up, you want to change jobs, and all of a sudden she's unemployed. So I think it's a very good idea, and what you're talking about, sometimes it's the idea that you own your own health insurance. So in other words, if you change jobs, you still have the same health insurance. I think they use the word portability on that. And I think that would help a lot with the problem then of people who are uninsured. Think about it a little bit from a common sense point of view. You've got automobile insurance. You change jobs. Do you lose your automobile insurance? No, it's your insurance policy. And that's the way health care should be done. Thank you.
Mr. Brewer, you had a comment?
I just want to reemphasize the whole aspect of too much regulation in the marketplace here. And it's this kind of regulation that ties the health care coverage to that particular employer because they get the deduction on that particular plan. And this is where Ron Wyden, I think in his free choice concept, where you could take those dollars and be able to buy a particular plan. And in some of these budget areas that we're going to go into in the economy, you know, there's some plans out there that will allow individuals to deduct the cost of that health care premiums and insurance as well. So the whole idea is when the free market can operate, needs can be met a lot better and a lot more efficient. And that's what we're driving to, so we don't have these tremendous hurdles and problems. I saw this firsthand in my business When we were a small company, we continued to improve and add the health care coverage with our associates and employees. We saw people coming to work at our business as we continued to grow. They had a problem trying to get the coverage for them. This is, when you're just trying to take care of your people and take care of your associates, these are the issues where government gets in the way, that you can't do what you want to do. And so again, I reiterate, choice and a little competition can offer some tremendous, powerful solutions.
Anyone else like to comment on whether or not you think the tax deduction should be for individuals also?
I think it's an interesting concept to look at, and again, on health insurance costs for people. I mean, this has been a problem for many, many years now, affordability and portability. And of course, Obamacare was presumably supposed to address that, which of course we know it didn't, and I would vote to repeal Obamacare in its entirety. But we need to put more competition into the health care field. There's no price mechanism right now, as you know, that allows people to allocate, that allocates resources, and transparency in price makes people aware of what they're purchasing. That doesn't exist today in healthcare. And those are the kind of things that need to be, to reflect more of a free market. Again, barriers to buying health insurance across state lines. You talked about automobile insurance. I mean, you turn on the TV, Geico, Progressive, any of those places, you see all the competition among prices. That's what we need in the health insurance area. And then the other thing that doesn't get discussed very much is the fact that health insurance companies are exempt from the antitrust laws. And, you know, if you're going to have competition, then you want to get them back under the antitrust laws so that they can't have monopolies. And that promotes competition. So all of those kind of things, along with the kind of concept where employers or employees could carry their health insurance from one job to another,
Okay.
is what we need to encourage.
Thank you. Any other comments? Mr. Beck?
Number one, the insurance company should have to compete in the open market just like everybody else. I don't know if you know or not, but the Catholic Church is suing our government because of the health care problems and the problems they have. And all of the organizations are going after it. I, being a Catholic, agree with them that they should be sued. But what the health care is, it's a taxation problem that brings taxes more into the government. That's why they installed it, because there's so many different programs in that health care that each one of them is taxed. The insurance company gets taxed, then the government gets the tax for it. So it's a taxation thing and a people-controlled system that they've installed. You certainly don't want the government telling you what to do or anybody else. You want to keep a free enterprise system, and you want to get individual inalienable rights so that you live free in this nation, not under some despotic government telling you what to do and telling you how you're going to be operated on or what they're going to do for you.
Do you think that individuals should be able to deduct that individuals should be able to deduct health care costs from their taxes just like employers do?
Yes, yes.
Mr. Memoli, any comments on individual deduction?
Thank you, Dr. Lilly, for this opportunity. And being the first to offer a standard deduction for health care costs makes sense on our W-2 form, because right now communities are picking up the costs. When you have an opportunity, please read Surrounded by Trees on Kindle. What that organization has done is anybody that has access to the internet, they offer a storyline that explains what we'll do with healthcare and many other issues. I had an opportunity this past week to learn from individuals that moved to Missouri from California. What's nice about interacting with people is that many times they offer ideas that you never even considered beforehand. Scott and Stephanie are part of our military family that works at Camp Whitehead. And he said, Mark, when I moved to Missouri, my health care is not the same as what I had in my previous state. And I thought, we have one U.S. military, and why wouldn't the health care be the same moving from state to state? It is, unfortunately, and by having that standard deduction, we'll actually save expenses. And what will we do by those savings? Well, what I proposed in our campaign, and if you go to Facebook and Twitter today, I would like Missouri to be associated with the energy and high-speed rail industry. The reason being is...
That's not, I got to interrupt you because that's not, you're
Thanks,
off of the...
thanks very much.
Off of the topic.
Glad I got it in, thank you.
We're got about 10 minutes left. I assume everyone would vote to repeal Obamacare, correct? Okay. One of the other areas that you can have for payment is a medical savings account. Are any of you, favor the medical savings account? Congressman Aiken.
Well, I don't mean to be first all the time. Yeah, it's a great idea. Yeah, because what you want to do is you've got a system that's about halfway socialized, and they want to socialize the other half. And they got the thing messed up when they messed up the first half. Now they want to thoroughly mess it up with the other half. And so what you have to do is get more back toward, as everybody's been saying, a free market kind of solution. And before you can do that, one, you have to have a consumer with some healthcare dollars in their pocket, and two, a healthcare system that'll give them an honest price for service. Right now, if you go to a hospital and say, what's an appendectomy cost? Poor guy will scratch his head. They got so much cost shifting going on, they don't know what things cost. So we need to do two things: get the consumer some money that he's going to be buying health care with, and the second thing is get some price established, and you're starting to get back more to the market-based system, and that'll also control the runaway costs.
Should that be part of Medicare? Should Medicare have and I know in the past, every time they try to have some kind of medical savings account, that's the first thing that the Republicans fold on and give up as a form of compromise.
Well, I'm happy enough with the medical savings account. I don't know exactly how that's connected with Medicare, but I'd say you could have it for people who aren't on Medicare. But if people on Medicare want it too, I think it's fine for anybody. And I also would make it so that when you put money into the medical savings account, you don't lose it at the end of the year. That's another dumb idea that people have been pushing. You keep it in there, and if you want to, pass it on. You may be not paying so much tax on it, pass it on to your kids. So you got, basically the idea is a market system. You have people with money, and you have medical providers that are going to charge you a price, and you can make your own medical decisions.
Anyone else want to comment on medical savings account? Like it, don't like it?
First of all, we should have a transition period so that seniors that are planning to collect from Social Security and Medicare, or people that are already on it, have a program that's eventually phased in. It makes sense because you don't want to create any anxiety or angst on anybody. So whatever program is going to be introduced definitely will be structured so that the government exits things that are currently being done that is not in the U.S. Constitution. Anybody, take a look at your U.S. Constitution. Was Social Security and Medicare included in it? No. And the reason why the Supreme Court in 1934 decided it is because at that time states were not in a position to offer that type of a program. Now we've advanced in so many ways with HSAs, 401ks, fixed annuity, a number of programs. It'd be long-winded to try to explain it. But when the government exits things that we can do as a state and as an individual, less taxes will be collected and more money will remain in our community as a result. Thank you for the time.
Thank you. Mr. Brenner?
Just to summarize, anytime you bring choice into a system, I've always believed that the free market has a way of working out all of these details. So I wouldn't necessarily promote the medical savings program for everybody, not necessarily support a premium support program for everyone. Some individuals may want to stay with the present system for whatever reason. They believe that may be the best. But the whole aspect is if you give choice to people, and people deserve choice, that then you can find, in the aspect of people freely making their free choices, find a way that prices are driven down and quality improves. So these are all good opportunities here, but let's provide those opportunities for the citizens of this country so that we can get this disastrous health care cost under control. And any of these would be a good path in the right direction.
One of the aspects of a consumer-driven healthcare system is one of transparency, where citizens know how well doctors are doing. They know infection rates, a lot of the details on how to rate doctors. Currently, the government mandates this on transplant services. So you can look at various transplant groups that do transplant operations. They have to report their readmission rate, their infection rate, et cetera, et cetera. Would you favor the government expanding that to not beyond just transplant, to generally hospitals and doctors, requiring them to have their, and Medicare is pushing is towards this, but having them mandate that you have to report infection rates for various surgeries, things that are their doctors' quality measures. Ms. Brenner.
Yeah, again, I'm going to sound like a broken record a bit, because after spending 33 years in the free enterprise system and seeing what competition and choice does in the marketplace and a tremendous value it drives to the consumers and the individuals here, I think that is an interesting suggestion. But I never would first of all think that we just go to government and more government to solve a particular issue. But as recipients of health care and trying to evaluate health care, or evaluate different doctors, or evaluate different hospitals, I would like to know the score. I would like to know the effectiveness and the quality and the infection rates. A lot of hospitals don't want to report infection rates. It's a very difficult area and very difficult to get under control. But, you know, the free market can provide organizations to evaluate hospitals. They can compete different quality organizations, evaluative organizations. It was the same way in our industry. We had outside testing organizations that evaluated our products. And we knew that some organizations had a better reputation than others. Our retailers knew that some organizations had better standards and quality.
Okay.
And so you bring free enterprise into these testing standards and allow these to open up, pull back the regulations, and let's get the information out. And I'm telling you, once you have a score, you're going to find the bar being raised for other hospitals and doctors to follow better processes and procedures.
We just have a few minutes. Yep, Ms. Steelman.
Oh, I was just going to say, I actually passed legislation in the state Senate that required that hospitals begin tracking their staff infection rates, and that they publicize that as well. And it was, and I got it passed, but it was very difficult, and still is difficult, to get that information available to consumers from hospitals, because for some reason they don't want to reveal that to consumers. But I would go back to the point, it's good to have a consumer-oriented healthcare, but you also need to have everything else that goes along with that, and that's transparency in prices and a price mechanism, and you know what you're getting. And so I think it all has to be done together, and if you just do one piece of it, it's more difficult. I don't like mandates, period. Okay. But if you're competing, then all of a sudden it becomes very your asset to say, hey, we've got a great hospital that has low infection rates, because you're competing with a bunch of others.
Okay, you just have a minute left. Let me do a quick yes/no question. I'm going to go right down the line. Is there a right to health care? Mr. Beck, yes or no?
No.
Mr. Brenner?
No, it supposes that you have the right to take someone else's goods and services from them.
Congressman Aiken?
No, sir.
Ms. Stillman?
No.
Mr. Memoli?
We have a responsibility for our fellow man when we do that, to help in the assistance and not do it at a cost that burdens the community. I would frame it a different way. And in answer to your question about HIPAA, President Clinton taught us the importance of that. And because I have sleep apnea, I take certain medication. Are my prospective employers entitled to that information? When you explain things, people understand. Okay. So I'd like to take a look.
Go to break, Mr. Member.
The answer is yes.
Dr. John Lilly, thank you very much for an interesting and enlightening conversation there about health care. When we come back, what could be the defining issue of this election season, the economy, with Jeff Baker. We'll be back in a moment.